Hi, I'm Dr. Alfredo Paredes, and I'm making this video to invite you to come to our continuing education course coming up, and also to give you some information about uh, the how to prepare for it. And let's go over the agenda real quick. Um, in this particular course, we're going to be talking about the fundamentals in implant prosthodontics, central relation in phase bows, and fabrication of occlusal programmer. One of our goals for this particular course is that after completing this continuing education course, we want you to feel confident about communicating and treating patients with temporomandibular disorders when it comes to treating with occlusal splints. Even though there are several ways to treat patients with TMD, I personally like using occlusal splints because it's a reversible treatment and it has a history of good results. Now, I'm going to share with you one of my patients in my office where I use central relation position as my starting point. And you can appreciate that in this particular case, there's actually only one contact on the posterior right side. The rest there's a gap. If I was to mount this case in maximal intertarsal position, I would be I would be missing a lot of valuable information on how to treat this case. That's why it is very important to use interrelation as a starting point. That will be used for the fabrication of the Occlusal programmer. Okay, so now moving on. For this particular course, we have some requirements, and because we want you to get the best experience, we want you to make some models, stone models of your own teeth. Once you made those models and trim it, please make 3 notches, as you can see in this particular picture, and bring them with you. We'll also appreciate any referrals, any friends, doctors that you might think could be interested in coming. We welcome general practitioners and specialists also to attend this course. Um, Also, how to contact us. Here you can see the phone number, and we'll be happy to have you in a course. A few important points. It is important that you make stone models of yourself because the plan for the course is to make central relation records and Facebook on each other. Then we're going to use those records to mount the stone models that you bring. If you were to bring models of your assistant or a patient, we would need a person there to make the central relation records in the Facebook in order to mount them. Because once the case is mounted, we're going to be utilizing these models to fabricate the occlusal deprogrammer or splint. One thing that we're going to be providing for you will be the articulators, the mounting disc, the face bows, the materials used for central relation records such as biorestoration materials. Also, we're going to provide all the materials to fabricate the occlusal deprogrammer, and we're going to be using the Ministar machine. And as I said, the materials will be provided. It's going to be a busy day. It's exciting. So I'm looking forward to meeting you there. So thank you very much. And don't forget to sign up. Thank you. Bye.